Unplugged in, 1 year into the coronavirus pandemic, a new national strategy from the new American president.
Our national plan launches a full-scale wartime effort. When I say wartime, people kind of look at me like, wartime? 400,000 Americans have died. That's more than have died in all of World War II.
The president's medical advisor on the race against time to get vaccines into arms amid new threats from this deadly disease.
The vaccines that we're talking about now have a very good safety record, and the risk of COVID-19 is overwhelmingly greater than the risk of a deleterious effect from the vaccine.
1 year in, there are new and more contagious strains while the world waits for vaccines to arrive. The challenges ahead on Plugged In, the new COVID normal. Hello and welcome to Plugged In. I'm Greta Van Susteren, reporting from Washington, D.C. Calling it a wartime undertaking, President Joe Biden is making the battle against the coronavirus pandemic his administration's top priority. Biden's national strategy for COVID-19 response has a baseline goal of vaccinating 100 million Americans in his first 100 days as president. January marked the deadliest month of the year-long pandemic that has infected more than 103 million people worldwide and leaving more than 2 million people dead. VOA's Steve Baragona takes us through the turbulent year of COVID.
I'm ready.
The long-awaited COVID-19 vaccine rollout is off to a shaky start. In the United States, many patients navigated overwhelmed websites and phone lines, only to have their appointments canceled.
I received a call that it was canceled and that they didn't know when they were going to get more vaccines.
The rocky rollout overshadows a remarkable scientific achievement, from brand new disease to safe and effective vaccine within 1 year.
What we're seeing now is the culmination of years of research which have led to a phenomenon that has truly been unprecedented.
Also unprecedented are the steps governments have taken to slow the virus. China was first, locking down 60 million people a year ago. As the virus spread, more cities locked down worldwide, emptying streets, shuttering businesses, and spiking unemployment.
This has been the most severe crisis for the world of work since the Great Depression of the 1930s. Its impact is far greater than that of the global financial crisis of 2009.
Lockdowns have set off protests in the Netherlands, Israel, and elsewhere. USA! Armed demonstrators showed up at some U.S. capitals in April, demanding the lifting of lockdown measures. Former President Donald Trump cheered them on. Many experts say Trump politicized the pandemic and hurt the U.S. government's response, undermining public health officials on basic prevention.
Wearing a face mask as I greet presidents, prime ministers, dictators, kings, queens. I don't know. Somehow, I don't see it for myself. I just don't.
And he promoted unproven treatments like hydroxychloroquine.
But I get a lot of tremendously positive news on the hydroxy, and I say, hey, you know the expression I've used, John? What do you have to lose?
Backers note that Trump poured billions into developing vaccines in record time. Yet Trump's pandemic response, pollsters say, was one reason he lost the presidency to Joe Biden.
To a nation waiting for action, let me be clearest on this point. Help is on the way.
Biden takes over as several new, more contagious variants have appeared. First in Britain.
According to the estimates of the people in the UK, about twice as transmissible and maybe even increase in its virulence or its ability to cause serious disease.
As Biden races to scale up the U.S. vaccine rollout, the World Health Organization warns that much of the world has not received a single dose.
I need to be blunt. The world is on the brink of a catastrophic moral failure. And the price of this failure will be paid with lives and livelihoods in the world's poorest countries.
A post-pandemic world is in sight, but it looks more unequal than before. Steve Baragona, VOA News.
President Biden is making the fight against COVID-19 his top priority. His national strategy targets 7 major goals, including expanded testing, accelerating vaccine distribution, establishing an equity task force, and preparing for future biological threats. In the first Plugged In, dedicated to coronavirus, Dr. Anthony Fauci said research for vaccine was already underway with help from specimens collected from the very first Americans infected with COVID. 1 year later, Dr. Fauci is the medical advisor for the pandemic for the new president, President Biden. He's part of the new team charged with getting vaccines into as many arms as quickly as possible. The director of the National Institute of Allergy and Infectious Diseases talked to me about the great challenges we still face. Let me ask you about, there are 4 strains, UK, South Africa, Brazil, and China. Are these different, or are they very much alike?
They are all SARS-CoV-2. They have minor differences that can lead to a functional difference, namely, antibodies might not react as effectively against them. Sometimes it makes it more transmissible, and even sometimes it can make it a little bit more virulent or maybe cause a different disease. We know that the UK variant, as well as the South African variant, and very likely the Brazilian variant, transmit much more readily. They get that additional functional advantage, but they're still the same SARS-CoV-2 virus.
All right, the new vaccine that's out, Moderna, Pfizer, J&J, that we're expecting, will that address the new variants?
It can, not completely as well as it does the wild type virus, which means the virus that has been with us right from the beginning, but it still has a considerable degree of protection, particularly against severe disease, namely hospitalization and deaths, but not as well when you're dealing with mild to moderate disease.
Is herd immunity realistic at this point?
I think it is if we get the overwhelming majority of the population vaccinated. I would think it's still an estimate. We don't know what the precise percentage would be to get to herd immunity, but a good estimate, I think, would be somewhere between 70 and 85% of the population vaccinated.
In terms of transmission, does it come on boxes and on surfaces, or have we moved away from that, or groceries?
Well, it is absolutely theoretically possible that that's the case, and likely that it does occur, but overwhelmingly it is felt that the major component of transmission is respiratory from person to person. Even from an asymptomatic person, which we know that 50% of all the transmissions come from a person who's either completely asymptomatic and will never get symptoms, or someone who's pre-symptomatic. Namely, they're not symptomatic yet, but within a period of a few days, they will become symptomatic.
All right. In terms of travel, if you get the 2 vaccines and you're about 14 days after the second dose, would you feel safe traveling wearing 1 mask or 2 masks?
I don't think you can make that quantitative difference. The CDC recommends that you wear a mask. Some people feel more comfortable because they feel you get an extra layer there. That's fine. There's nothing wrong with wearing 2 masks. If you feel that it's making you more comfortable, more snug, a better protection, you can. But there's no CDC guideline yet that says that 1 mask is not as good as 2 masks. They will be studying that soon, and hopefully we'll get some information on that.
What's your position on traveling, assuming you've had the 2 vaccines and it's been a number of days since your second dose of the vaccine?
Well, it depends on your willingness to take risks. I mean, the risk is less if you've been vaccinated, no doubt. If you have a vaccine that's 94 to 95% effective, the risk of your getting infected, or certainly the risk of your getting sick, are far, far lower than prior to the vaccine. But there still is a risk. So you have to ask somebody, what level of risk are they willing to take? Right now, we still say, please, unless you really have to, don't travel. And that still goes.
Let me turn to COVAX. That's sort of a cooperative program to help get the vaccine around the world. Is that right?
Yes, it is.
And tell me about it, and tell me how it will help like nations in the African continent.
Well, clearly, not every country in the world has the resources or the capability of getting vaccines for the people in their country who need it. And everybody needs a vaccine throughout the world, whether you live in a rich country or in a poor country. COVAX is a consortium of countries and organizations which have agreed to put in significant resources to be able to get vaccines to those countries that can't afford or don't have the capability of either making a vaccine or getting it to their people.
And is that going to get the vaccine quickly to these places? I mean, is it already moving to those countries? Because I know there are a lot of people in the United States who claim they can't get it.
Well, this is not something that's going to take vaccine away from Chicago or New York or San Francisco and send it to a foreign country. Not at all. That's not what we're talking about. We've already contracted to get enough vaccine for everybody in the United States. Those contracts have already been let. And over a period of months, we will get more and more and more until we get the full component that we've contracted for.
I know this is an impossible question, but will there be a time when we, quote, get back to normal? Is there a possible way to estimate that we're not going to be wearing masks all the time and not talking vaccines? Or is this the new normal?
I think we will ultimately get back to close to normal. I think there'll be much more attention paid to public health measures. But I think if we get the proportion of people in the country that I indicated, which is an estimate of what herd immunity would be, namely 70 to 85% of people, then I think we really would be approaching a rather significant level of what we would call normality. Maybe not 100%, but certainly not the stringent restrictions that we're under now.
Is there any reason in your mind people should be afraid of the vaccines?
No, I mean, the vaccines have been shown to be very safe. Historically, vaccines are the safest and most effective prevention for infectious diseases. The vaccines that we're talking about now have a very good safety record. And the risk of COVID-19 is overwhelmingly greater than the risk of a deleterious effect from the vaccine.
Dr. Fauci, thank you very much, sir.
Good to be with you, Greta. Thank you for having me.
Among the first places to identify a new strain of COVID was Great Britain, where now 100,000 people have died from the virus. That's the most in Europe. VOA's Henry Ridgewell reports from London.
86-year-old Gordon Bonner says he is lost in a hinterland of despair and desolation. It's 9 months since Muriel, his wife of 63 years, died from COVID-19. He was called to her bedside for the final moments.
And I sat for the next hour and watched Muriel drown in her own body fluids. It's the most harrowing experience of my life, and it will haunt me. And I'll tell you why. Such was her fight for oxygen that she was sucking at the air and I can still see her face now, and her lips formed a perfect circle as if she was sucking through a straw.
A haunting account of loss and grief, emotions that have touched families across the country. Britain Tuesday became the first European country to report 100,000 coronavirus deaths. 25,000 of those have occurred in the past 3 weeks. It now has the highest coronavirus death rate per capita in the world. Prime Minister Boris Johnson said Wednesday he shared the nation's grief.
I and the government take full responsibility for all the actions I have taken, we've taken during this pandemic to fight this disease. And yes, Mr. Speaker, there will indeed be a time when we must learn the lessons of what has happened.
Johnson announced an extension of school closures and the enforced quarantine of travellers arriving from high-risk countries. Critics say he's done too little, too late.
The Prime Minister was slow into the first lockdown last March. He was slow in getting protective equipment to the front line, slow to protect our care homes, slow on testing and tracing, slow into the second lockdown in the autumn, slow to change the Christmas mixing rules, slow again into this third lockdown.
Many scientists blame underinvestment in the National Health Service.
We suffered from not having an adequate public health infrastructure in this country. We didn't get test, trace and isolate right, and that's still a big challenge for this country. So keeping a lid on infections by effective testing, tracing, and then encouraging people to isolate is really important. And we didn't get border control right.
While Britain leads Europe in coronavirus deaths, it is way ahead in its vaccination programme. Close to 7 million people have received their first vaccine doses.
And it should mean that come March time, we're in a much stronger position in terms of being able to review the current lockdown restrictions.
But there are growing concerns of a vaccine shortage. Drug firms AstraZeneca and Pfizer warned the European Union this week of delays as production systems are scaled up to meet demand. The EU has threatened to block exports of vaccines produced in Europe. Meanwhile, the British government says the public should be prepared for further bad news.
Unfortunately, we're going to see quite a lot more deaths over the next few weeks before the effects of the vaccines begin to be felt.
So, tragically, thousands more families will have to endure the grief of losing loved ones before their time. Henry Ridgewell for VOA News, London.
One place in the world where the vaccination rollout is succeeding is Israel. About 1/3 of Israel's 9 million citizens have been vaccinated, and about 1 million have already gotten their second shot, including most people over 60 years old. For more about what Israel is doing, I spoke to VOA reporter Linda Gradstein in Jerusalem.
The fact that everybody has health care, the records are digitized, and they already have a whole series of clinics really made it easy to kind of roll out this vaccine. And in 6 weeks, 3 million people have gotten the first dose of the vaccine, and half of those have gotten a second dose as well. I mean, it really is quite an impressive undertaking, and the vaccine rollout has been handled very well. So Israel in some ways was kind of out ahead of it and has certainly started a very impressive vaccination campaign. But at the same time, COVID is still here, and they've tried to do these lockdowns, basically cutting off schools, cutting off everybody staying home. The problem is it's not quite working. There are certain populations that are not running to get the vaccine. For example, 20% of Israelis are Arab citizens of Israel, and the vaccination rate has been significantly lower there. So while certain populations, the rate of vaccination is extremely high, it's still not high enough for Israel to get herd immunity.
Well, so how is it that Israel sort of got ahead of everybody else in terms of getting this distribution of the vaccine?
Israel has socialized medicine. So you pay a portion of your income and everybody has automatic health coverage. And Israel's also a small country. You can drive from one end to the other in about 7 or 8 hours. So for example, my distribution site was the local sports arena. And when you walked in, you got an appointment, everything was online, all medical records are digitized. Israel also bought the vaccines very early, paying, at least according to media reports, double the market price for them. And in addition, Israel volunteered to kind of be a test case for Pfizer. You've got a population that's small, that was willing to be vaccinated, and you've got digitized medical records. So it was very easy for Israel to roll out this vaccine and for people to go and get vaccinated.
In Israel, with giving out the vaccine, was it done in stages? Like in the United States, there are places like over age of 65 or frontline healthcare workers first. I mean, how was it actually distributed?
So it started with anybody who was above 60 is how they started. And the campaign only started 6 weeks ago, and everybody is able to make an appointment. It started with over 60. And in fact, I had been in the vaccine center the day before for a story. And I said, my husband, who just turned 60, is coming tomorrow. If I come with him, can I get it as well? And they said, sure, no problem. And there was a great Facebook post of one of the vaccine centers had extra doses at the end of the day. And the nurses went out into the street, caught the pizza guy and said, hey, pizza guy, you want to get vaccinated? So within 6 weeks, so they started over 60, over 50, over 40, and now it's everybody.
Was Israel ready for the Pfizer? Pfizer requires that it be kept frozen about 100 degrees below zero or something, and so refrigeration is a big issue with Pfizer. Was Israel prepared for that, or did they start getting ready for it last summer? How did Israel accommodate that?
So I don't know if they started getting ready last summer, but they definitely were able to keep the vaccine at the temperature that it needed to. They got whatever freezers they needed to. And Israel has given everybody the Pfizer vaccine except for people who were homebound, and they were given, medical workers went to their homes and they were given the Moderna vaccine specifically because of that freezer issue. But in all of the vaccination sites that people went to, it was the Pfizer vaccine that was kept at the proper temperature.
And so you've had no stories about Pfizer vaccine being left out and have to be destroyed. I guess the pizza guy getting his is one example of having a leftover and they have to give it, so they gave it to him.
Right. So there have been there were some reports that they actually found extra doses in each vial, that a vial that was supposed to have 5 doses actually had 6 doses. And it was actually kind of funny because, you know, the Hanukkah story, it happened around Hanukkah. The Hanukkah story is how one little tiny bottle of oil lasted for 8 days. So people said it was the Pfizer Hanukkah miracle. But I know they have wasted almost no doses. And in fact, because everything is digitized, they sent some of the health maintenance organizations, these HMOs, sent out messages saying anybody who wants a vaccine can come right now to this place.
What about the issue of privacy with all the information that's being gathered about the people who are getting vaccinated in Israel and the sort of cooperation with Pfizer and Pfizer looking at it? Are there any objections, or do you actually have to sign any waivers, or is everyone agreeable to be part of essentially a big study?
So first of all, the data is supposed to be anonymous. In other words, it's supposed to be aggregate data of how many people got corona after the first vaccine, how many people got corona after the second vaccine. It's not supposed to be individualized data. It's one of the interesting things to me that privacy issues in Israel are not that big of an issue. There have been a few, NGOs who deal with privacy issues who said maybe this isn't a good idea. The Ministry of Health publicized most of the agreement it made with Pfizer, and there hasn't really been a response from Israelis. Maybe I think people sort of know that was part of the deal, and they feel that it was worth it in order to get enough vaccines. So there hasn't really been an outcry on privacy issues.
I read that the ultra-Orthodox community also wasn't complying with the lockdown, and they're keeping the schools open, which is, not a lockdown. Is that contributing to the difficulty in sort of eradicating or protecting the people in Israel from the spread?
Not only are the ultra-Orthodox community keeping the schools open in defiance of the law, yesterday there were 2 mass funerals of 2 rabbis who died in their 90s of COVID. One funeral had 10,000 people, and the other funeral had several thousand, and completely violating the law. The police said, "What do you want us to do?" There's a lot of anger in the non-ultra-Orthodox public who say this is simply not fair.
Do the Palestinians want Israel to get them the vaccine? And what I mean by that, are Palestinians in the West Bank or in the Gaza Strip, do they say the Israelis have an obligation to get them vaccinated?
There's been a question about the Palestinians and, should Israel be vaccinating the Palestinians? The West Bank and Gaza, there are 5 million Palestinians. There are tens of thousands of Palestinians from the West Bank that come to work in Israel. And there's sort of a debate about this with some Israeli officials saying that according to international law, they are not responsible for vaccinating Palestinians. Others say they are. It depends on your interpretation whether or not Israel's responsible. It is important to say that they are vaccinating Arab citizens of Israel, which is 20% of the population. They are vaccinating Palestinians in East Jerusalem, which is about 40% of Jerusalem's 800,000 residents. But at this point, they just agreed to send 5,000 doses to the Palestinian Authority for healthcare workers. Israel's defense minister and former chief of staff said he believed that Israel should be vaccinating the Palestinians. And Israeli officials have said that after all Israeli citizens are vaccinated, if there are extra doses, they will give it to the Palestinians. Basically, Israel and the West Bank, it's very hard to separate. So a lot of people are saying that, whatever the moral implications are in terms of herd immunity, Israel should vaccinate the Palestinians.
Linda, thank you. Always nice to talk to you.
You too, Greta. Nice to talk to you.
The Director General of the World Health Organization pleaded with governments to prioritize vaccines to those most at risk in all countries of the world. India is the world's largest vaccine producer and is sending COVID-19 vaccines to neighboring countries. India is using vaccine diplomacy to raise its global profile and win back influence in South Asia from China. More from Anjana Pasricha in New Delhi.
This is the most precious medical cargo for countries waiting to launch COVID-19 immunization programs: vaccines. Days after rolling out a nationwide inoculation program, India, the world's biggest vaccine producer, donated millions of doses of the British-developed AstraZeneca vaccine to Nepal, Bangladesh, Bhutan, the Maldives, Seychelles, Mauritius, and Myanmar. The affordable and easily storable vaccine being made by an Indian company in partnership with AstraZeneca is in huge demand in developing countries. The goodwill gesture won praise from neighbors such as Bangladesh.
A friend in need is a friend indeed.
Indian Prime Minister Narendra Modi has emphasized that neighboring countries will be prioritized in the distribution of vaccine supplies. The initiative is called Vaccine Friendship. The vaccine diplomacy, say analysts, is a means to push back against China, which has been expanding its influence in South Asia. While China is also giving its vaccine to several countries such as Turkey, South Asian countries had sought supplies of the AstraZeneca vaccine developed in Britain.
India will want to make a point here that in this area, unlike in some others where China usually overshadows India in terms of military and economic might, in this field, in pharmaceuticals, in healthcare, in affordable healthcare especially, India has actually a comparative edge and advantage over China. So I think that will be certainly a subtle message going around that you can depend on us.
New Delhi has also begun commercial shipments of vaccines. The first consignments have reached Brazil and Morocco. More will go to countries in Africa and South America in the coming months. Following New Delhi's approval of the AstraZeneca vaccine and one developed by an Indian company, Modi said this month that India will play a frontline role in providing vaccines.
आज भारत एक नहीं.
Today, India with not one, but 2 made-in-India vaccines is ready to protect humanity. Being pharmacy of the world, India has supplied essential medicines to the needy across the globe in the past and is doing it today as well.
जरूरी दवाएं पहुंचाने का काम भारत ने पहले भी किया है और आज भी कर रहा है.
As Indian companies ramp up production to meet the huge demand, India hopes to raise its global profile by being seen as a country that will help end the pandemic.
It's a lot of this has to do with image. So the vaccine diplomacy is not about concrete, material benefits. It's about image and soft power.
There has been growing criticism of vaccine inequality. While inoculation programs are well underway in wealthy nations, developing countries are struggling to secure supplies. Anjana Pasricha for VOA News, New Delhi.
That's all the time we have for now. My thanks to Dr. Anthony Fauci and correspondent Linda Gradstein. Stay up to date at voanews.com and follow me on Twitter @Greta. Thank you for being plugged in.